easy. So I'm Sammy Bros, one official Samloko. Subscribe, share, and like. So today I'm going to be answering few questions, simple few questions. So now, first, what is another term for false pregnancy? We have ectopic pregnancy, molar pregnancy, pseudopsis, and embryonic pregnancy. So our answer is pseudopsis. So now, why is this pseudopsis? It says is the medical term for false pregnancy, where a woman believes she's pregnant and exhibits symptoms without an actual pregnancy. So what does it mean? That a woman can be having symptoms of pregnancy, but she's not pregnant. She's nowhere close to pregnancy. She's just having that. Let's say that there are some kind of abnormal discharge of hormones, and she begins to feel like she's pregnant. But when they run some tests, they find out that there are no pregnancies. Now, we go to number two. Which of the following is not a symptoms of false pregnancy? We have missed periods, weight gain, positive pregnancy tests, morning sickness. So now you can see that when you can see that missed period is surely a sign that there is true pregnancy. Weight gain is also a sign that there is pregnancy. Morning sickness is also a sign. But it says here, which of the following is not a symptom of false pregnancy? So we can see that our answer is positive pregnancy test, because positive pregnancy test shows that you are actually pregnant. Now it says here that false pregnancy, the pregnancy test is usually negative despite other pregnancy like symptoms. So over to number three. Which hormone level is typically normal in case of false pregnancy? We have HCG, progesterone, estrogen, and prolactin. It says which hormone level is typically normal in cases of false pregnancy. We can see that is HCG, because when a woman is pregnant, HCG or absence okay, it says which hormone level is typically normal in case of false pregnancy. We have HCG, we have progesterone, we have estrogen, we have prolactin. So the answer is HCG. Why? Because when a woman is pregnant, the HCG levels, the human chorionic gonadotropin, tends to go high, which ensures that pregnancy is is made possible. Now, they say the rationale in false pregnancy, pseudopsis, HCG levels are usually normal or absent since there is no actual pregnancy. So when there is no actual pregnancy, the HCG levels are usually normal. Which of the following treatment is most effective for false pregnancy? Hormonal therapy, psychological counseling, surgery. Because a woman that is having false pregnancy, the only way to help her is to counsel her. You cannot do a surgery. Bed rest is not important because there are no ovulations, there are no signs of pregnancy. But psychological counseling, let's see what the rationale is. Psychological counseling helps address the underlying emotional and psychological issues causing pseudopsis. Now, if you are in this class now, I want you to like and I want you to comment. This is a teaching about exam preparation for for midwifery exams. So even if you are not a midwife, you can share it to your friends, or you can like, or you can comment in order for us to know that you are following. Now we move over to number five. It says which prenatal test is commonly used to detect chromosomal abnormalities? We have amniosynthesis, we have ultrasound, we have maternal serum screening, we have non-stress test. So the answer is amniosynthesis. Why? Amniosynthesis involves sampling the amniotic fluid and can detect chromosomal abnormalities like Down syndrome. Ultrasound cannot be the answer. Maternal serum screening cannot be a non-stress test. Now, number 6, it says, which condition is characterized by the absence of part or all of one X chromosomes in females? Which condition is characterized by the absence of part or all of one X chromosomes in females? We have A, we have Tunnel syndrome, Klinefelter syndrome, Down syndrome, Fragile X syndrome. And the answer is Tunnel syndrome. Why? Tunnel syndrome is characterized by the complete or partial absence of one X chromosomes in female. In order for you to learn most of these things, I advise you to always carry a pen and paper by your side, because it's not because that you're not a nursing student doesn't mean that it doesn't concern you. You can actually learn about health. It's your health. It might be your friend's health, it might be your own health. It can be anybody that you can come across and you can share a knowledge with. That's why I advise you should share and comment. Now, number 7. What is the primary cause of neural tube defect? We have genetic mutations, we have folate deficiency, we have maternal infections, we have exposure to radiation. Now the answer is folate deficiency. Now folate deficiency is a major cause of neural tube defects such as spina bifida and encephaly. So what is this folate deficiency? You know that in some pregnant women, they are advised to take folic acid. Why are you advised to take folic acid? Is because it helps you. It helps you in the sense that your child can grow better, your child can be healthy, your child can, be able to grow, and your child may be sound and okay. But when you are lacking this folic acid, when you have a folate deficiency, it can cause a lot of problems for you and for your baby. When you go, you can ask Google to search for you this spinal bifida. It's a very, very, very interesting topic. It's a very, very interesting topic because it shows you what a baby is like when they have deficiencies of this, when they have this folate deficiency. Now, we go over to number 8. It says, which fetal abnormality is associated with maternal diabetes? We have Down syndrome, we have congenital heart defect, we have cystic fibrosis, and we have hemophilia. So, according to the answer, it says congenital heart defects. Rationale: maternal diabetes is linked to a higher risk of congenital heart defects in the fetus. Now, when you talk about diabetes, most of us know what diabetes is all about. We don't need to overstress, but for the sake of knowledge, you know that when you eat too much carbohydrates, you put yourself into problems. Yeah, there are a lot of problems you put yourself. That's why you advise, when you are taking the 6 classes of food, make sure you take them well. Make sure that you advise that you mix your carbohydrate, your protein, your fat, your oil, and everything, because this congenital heart defects affects babies and it can cause a lot of harm to them. Now, there are some words that you may see here you've never come across or you have been across. It is always advised to go to Google to always make sure that you learn, or in the coming weeks we'll be able to treat each and every one of them as a topic. Now, number 9. What is the common term for trisomy 18? So we have Down syndrome, Edwards syndrome, Patu syndrome, and we have Klinefelter syndrome. I'm supposed to be explaining this, everything that you see here, but we have we have we have a lot to do. So we're back again. Says which abnormality results from a deletion on the short arm of chromosome 5. I feel like most of these things are usually big. Yeah, they're usually big and I feel like they are much. So hold on. Even after the you have to go through. So now, so for all that we are here before, you can see the topic that is here, the folic acid deficiency, megaloblastic anemia. So I'm going to be reading it out for you. It says that folic acid is needed for the increased cell growth for both mothers and fetus, but there is a physiological decrease in serum folate level in pregnancy. It says folic acid is present in all food of plant and animal origin, particularly leafy vegetables and fruits, pulses and yeast. So there are a lot of topics in midwifery that one can actually sit down and try to embark on, but when you don't have enough knowledge, when you don't have good knowledge on what you're treating, some of us may not understand what it's all about. It's not just all about showing questions, but it's also about what do you learn. So you go work here, present one. Give me this.
My boss.
So today we're talking about, we have gone through some past questions first. Go through some topics first. Why don't we deal with disorders caused by pregnancy?
And I go be my boss.
Okay. We're going to be talking about disorders caused by pregnancy. Say that some diseases that are peculiar with pregnancy, but somehow the rate and incidence of these uh, diseases are lower and they no longer constitute serious problems. So what we're talking today is disorders caused by pregnancy. So said that some diseases that are peculiar with pregnancy, but somehow the rate and the incidence of these diseases are lower and they no longer constitute serious problems these days because of improved general health of people or population, improved social condition and lower birth rate per women or lower parity. Which fetal